if this clicker works. Oh, somebody's clicking for me. Great. There we go. Mystery clicker behind the curtain, I think. So hi all, I'm Mona Byrkit with PATH. It's really nice to be here. I had no idea it was going to be snowing. Haven't seen snow in over a decade. But I'm going to talk a little bit about my experience in Vietnam, where I lived for the last 9 years, and the public-private partnerships that we've got going on as PATH. If you don't know PATH, there are several of us here today, but we're a global health organization. We're comprised of health engineers, doctors, IT people, community people. We've been around for about 41 years, and we're working in over 70 countries. Vietnam is one where we've been the longest. We've been there for actually 38 years, so we were one of the first US-based health organizations to be working in Vietnam after what they call the American War. And we've been working globally, though, starting in Asia for 41 years. Really, in our DNA, I would say PATH is one of those organizations from the beginning that was really looking at public-private partnerships and working with corporations to bring new technologies to countries, particularly in the beginning around contraceptive technology, but now, as if you know PATH, we do a lot more than that. And I'd really say our success in terms of health impact around the world, but particularly where I've been working in Southeast Asia, has a lot to do with our ability as an NGO, as a nonprofit organization, to help translate from the public sector to the private sector and vice versa, and help build trust, help build those bridges. So I'm going to give a specific example from my experience in Vietnam. As I mentioned from the early days, we were a reproductive health focused organization, so we got our start working in family planning and bringing new technologies to countries in Asia of how to make state-of-the-art condoms. And then we grew from condoms to other contraceptive technologies, and we saw that this approach to connecting private sector technologies and innovators with government needs for their public health programs worked very well. And then when we looked at areas, particularly in Vietnam, where the private sector wasn't engaged, such as TB control and HIV, that this was another great strategy to engage with the government to help them understand, in order to reach as many people as possible, in order to strengthen the overall health system, it was going to be critical to engage the private sector. Oh, I was happy to see Ann Aerts here earlier, too. We, just going back, we've got a great project with Novartis Foundation on hypertension in Ho Chi Minh City. So a great example of collaboration with Novartis Foundation and PATH and the government of Vietnam. I'm going to spend a little time talking about HIV, where we've been working for a few years on a project with PEPFAR and USAID, looking at HIV prevention and care program called Healthy Markets. There are about 250,000 people in Vietnam now who have HIV. That sounds like a lot, but compared to a lot of countries where maybe some of you have worked in Africa, it's still a small number compared to the population. It's less than 1% of the whole population that is infected with HIV, but in certain populations, it's double digits. So key populations like sex workers, people who inject drugs, transgender women, female sex workers, it's quite high. And we've even seen in recent years increases in particularly the MSM community, men who have sex with men. There's not a lot of data about transgender women, but a recent study in Ho Chi Minh City indicated about 18% of transgender women have HIV. And in certain parts of the country, we're seeing increases in people who inject drugs continuing to get infected. That said, it's a very strong national program led by the government. And they've been able to reduce new infections since the height of the epidemic in the 2000s by over 40%. But the bulk of the government's program has been funded by international donors. So what happens, oops, how did I go backwards? When a country reaches middle income status, as Vietnam did right after I arrived in 2010, labeled lower middle income country, and the donors, that's kind of a signal to donors that maybe it's time to move out or certainly reduce their investments. So if you can see the graph, when I arrived 2009, 2010, the budget for the AIDS program was at an all-time high, but it was coincided with the time that the donors were packing their bags, as were many NGOs. And with that decline, the government was left with, a program that they simply didn't have the resources to fund. However, they had made the ambitious statement that they would eliminate HIV by 2030. So they were seeing incredible traction from the program, but then their investment was drying up. And the question was, how are they going to meet these goals without the required funding? There arrives PATH and the Healthy Markets program. Ironically, or I don't know exactly why, the donors and the government hadn't really seen a role for the private commercial sector in the HIV response for many, many years. And this is a project that is specifically designed to engage private sector partners from different industries in terms of communicating about HIV, to increase demand for services, but more importantly, increase the private sector supply of HIV goods and services. We've talked quite a bit this morning about shared values versus other types of corporate engagement. So PATH has historically generally worked with a shared values model, that we work with companies, whether they be small indigenous social entrepreneurs or large multinational pharmaceutical or other companies, on really looking at what is the interest from the business to work in a country, and do we find shared common goal with them in terms of societal needs. Sometimes it works and sometimes it doesn't, and I'm sure we will talk a little bit about that. But the Healthy Markets Project is definitely a shared values approach. And I asked the team to share some of their kind of key steps as an NGO looking to partner with the private sector. This list was probably double this, so I'm not going to read all of them, but maybe just highlight a couple that have also come up in the morning sessions. Really important as a nonprofit, or if you're working for a non-commercial entity, to really do your research on what are the likely private sector partners that could have goals that align with yours, and do your own market research. Where are people going for their goods and services? How much are they willing to pay for services and goods, and are they able to pay? And then starting small, not trying to spread yourself too thin. We do due diligence process to vet corporations within our own organization. Do we want to be publicly aligned with them? What are the risks being associated with those companies? I think this whole idea of move quickly relative to a typical way of working in a nonprofit or the government, versus also being patient and ready to know that shared values partnerships takes a long time, as you pointed out earlier. But show respect and appreciation that it's not a bad thing to want to make money. And sometimes I will definitely be the first to say, within nonprofits, there is an aversion to collaborating with groups that have profit motive first and foremost. And even some of our donors have the same response, but not all. And that's changing. So to give two examples of how Healthy Markets is working with private sector entities, we're working both on the commodity side in HIV space as well as services. In Vietnam, there are a number of local condom manufacturers who historically have only manufactured for export. Why? Because the donors were providing so many free condoms that they were either giving out through NGOs like PATH or others, or massively subsidizing. There was no market incentive for them to sell to the Vietnamese market. So we work closely with them to say, hey, look what's happening. These guys are going to be leaving. You have a huge market here. And helping them understand the potential and what we'd already learned for what marketing tools would work for these communities. We've also worked with major manufacturers and distributors of drugs and new diagnostics, and helped kind of bridge that dialogue between the international partners who want to enter the Vietnam market and what it takes to get licensed, how to show a successful pilot, and what that would mean to the overall HIV program. And then we work with traditional and non-traditional distributors and retailers. On the services side, when we wrote our proposal a few years ago, I had some of my staff say, we can't put anything about services because the government will never allow HIV testing in the private sector. That's just not going to happen. This is Vietnam. And we said, but let's just test that assumption, because TB, it was the same thing when I arrived 9 years ago. There was a lot of concern that this would never happen. There would be a huge backlash. And I think by having 38 years in Vietnam as a trusted NGO partner, be able to dialogue with the government about what we call a total market approach. What is the government's role to be a steward of the whole system but allow for private sector actors to help with reach? It has actually changed. So there are now private clinics that are able to offer quality, low-cost services. We've got self-testing and lay provider testing as well, which is quite remarkable given where we were just a few years ago. What are some of the challenges and barriers? We also just discussed that in the previous section. A lot of times the interests are simply not aligned. You may have many, many conversations and decide there just isn't a common goal. These coalitions do take a lot of time, and there can be a perception that there's some kind of a bias, or, I've had my staff say there's concerns, from people that somehow PATH is getting kickbacks from these if we're too closely aligned with one company or one product. And that's hard to counter that, but we need to continue to explain that that's actually not the case. We're really focused on expanding choice and hopefully lowering prices in the overall market. Governments are sometimes skeptical, and sometimes companies are also less than willing to share some of the data that would be really, really helpful for governments to actually do their targeting of where their products and services need to be targeted. Some donors, as I mentioned, really like this approach. USAID has been out there, as we heard, for multiple administrations saying this is the way forward, but some are also fairly resistant. But what it's meant overall in Vietnam, which I think is a wonderful thing in a country that has a thriving health system but still a lot of inequities, it's meant thousands more cases of TB diagnosed through the private sector that wasn't possible just a few years ago. It's meant millions of more women, girls, and couples have access to family planning. And now having HIV testing available in the private sector or through lay testers or self-testing is really going to make tremendous difference in helping the government reach their goal of no HIV by 2030. Over 100,000 people just in the last 2 years that got testing this way, resulting in over 4,000 cases diagnosed that over 90% of those are now on treatment. So I'm going to stop there. I could tell you way more stories from lots of other projects, but I wanted to give you one concrete example that maybe comes some of the theory that we've been talking about this morning come to life a little bit from the perspective of an NGO. Thank you.